So next topic is disseminated intravascular coagulation, V10. What is DIC? It's a pathological activation of coagulation and fibrinolytic pathways by circulating phospholipids. This leads to thrombin and plasmin production, resulting in the unbalanced coagulation cascade, leads to widespread microvascular thrombosis and fibrin occlusion of the small and large vessels, results in shock and end organ failure, low cardiac output, tachycardia, and hypotension, and patient develops a bleeding tendency due to consumption of clotting factors and platelets, petechial rash, and bleeding from the mucosal surfaces. What are the causes of DIC? So any disorder that causes activation of coagulation system, it could be in the form of severe sepsis, gram-negative sepsis, particularly viruses, CM, cytomegalovirus, HIV, and hepatitis. Organ destruction, for example, severe pancreatitis and burns, trauma, tissue injury or crush injuries, transfusion reactions, obstetric emergencies like amniotic fluid embolism, retained fetus syndrome, placental obstruction and eclampsia, severe hepatic failure and disseminated malignancy. Why do patients with DIC develop anemia? Because the microangiopathic hemolytic anemia happen due to the red cells or fragments. What are the blood results in DIC? All blood results are deranged, raised D-dimer, fibrin degradation product which indicate activation of the fibrinolytic system. Platelet count less than 15,000 because of the consumption with activation of clotting cascade, decreased fibrinogen, prolonged PT, thrombin time, and APTT, reduction in the individual clotting factors, red blood cell fragment on a blood film, and prolonged clotting, low platelets, and elevated D-dimer is enough to diagnose. What is the thromboelastography? It's a point of care which provides an in vitro assessment of the coagulation system in the whole blood sample from beginning of the clot formation to the fibrinolysis. The exact component lacking in the coagulation cascade can be identified and replaced quickly. How do you treat DIC? Treat the underlying cause, platelets and fresh fibrinal plasma, replace the consumed factors only if the patient is bleeding or there is a risk of bleeding. Platelets less than 50 in the presence of bleeding and less than 10 without bleeding. Antifibrinolytic therapy, cryoprecipitate fibrinogen, packed red blood cells, and early hematology advice and support needed.